All right, so welcome to week 6. You're halfway there. So today's lecture is on chapters 13 and 14. So chapter 13 is community assessment and evaluation. And then chapter 14 is on health education in the community. So I have the slides up for you. So when we look at community health, the public health nurse or the community health nurse is in a great position to view the community as a client, as well as to begin to identify and look at the strengths that are present in the community, as well as to meet the challenges of the community. And so when we look at what a community is, it's where we live, it's where we work, it's where we spend our time. So the definition of a community is a group of people, as in a defined population who share something in common. So it, just such as geographic location, interests, or values. A community is a system. In most definitions, a community includes 3 factors: the people, the place, and the function. The World Health Organization definition is a group of people often living in a defined geographical area who may share a common culture, values, and norms, and are arranged in a social structure according to relationships which the community has developed over a period of time. So it is a system. Community is a system. It's not just the people and the characteristics of those who live there. And so there's 3 common factors in community definitions. We have the people, right? Those are the people that live in a community, who work in the community, who share, groups within the community, and that's our aggregate. The place is just the geographic location or other shared spaces. And then function is the aims and the activities of the community. And so just like it says here, it is a concept. People living in a community may describe their community differently based on their experiences within. So when we look at, the role of the community health nurse, we are, the community health nurse is a key player in assessing the needs of the community. So they interact, they establish contracts with community partners, they serve the community at large. They also witness the interactions between community programs, as well as the response of the community or the community to services that are available. And we are also able to identify future services based on the visible needs of community members and population groups. So when we look at doing a community assessment, it is a comprehensive approach that's going to emphasize the community as a client, with the goal of providing benefit to the people in the areas as a whole, not just specifically to individuals. So when we focus on the community as a client, we can apply direct primary, secondary, or tertiary interventions to be a part of that population-focused community health practice. And so the goal of these is to improve the health of the community as we set up as we do our assessment, our planning, and start our interventions. That is the primary goal, is to improve the health of the community. So when we look at making change, we know that changes in individuals or even populations can ultimately affect the health of the community. And so there's 2 key concepts here: community health and then partnership for community health. Community health is the health behaviors and the outcomes of its residents, and also the ability of the community as a system to support the healthy individuals. And so again, we're looking here at the overall community, not just individual people. With the World Health Organization, they describe 4 aims of health communities. Those are supporting individual health, promoting quality of life, distributing the resources needed for basic sanitation and hygiene, and then creating an accessible healthcare service. When we look at Healthy People 2030, they provide the foundation for national health promotion and disease prevention built on 5 goals. To attain healthy, thriving lives and well-being free of preventable disease, disability, injury, and premature death. Eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. Create social, physical, and economic environments that promote attaining full potential for health and well-being for all. Promote healthy development, healthy behaviors, and well-being across all life stages. And lastly, to engage leadership, key constituents, and the public across multiple sectors to take action and design policies that improve the health and well-being of all. So that is those goals for your Healthy People 2030. So when we look at community partnerships, community partnerships is partnering with community members to help hopefully have successful community health programs or interventions, and involving the community members not only in data collection but in all phases of the assessment so that we get more accurate and more relevant information regarding the concerns of the community. Those partnerships also promote community members' investment in the success of the assessment and the resulting projects to improve community health. So NUR206's role in the community is to establish credibility and trust. And we need to partner both with those members in the community health workers, and to get the necessary information that we need to have in order to make a positive difference. So when we look at the purpose of it's and from the inside out for the purpose of identifying and analyzing conditions. So, community assessment or community needs assessment is what we're looking at. It's one of the 3 core functions of public health. It requires clinical judgment, critical appraisal of multiple types of data from a variety of sources. We need to have a clear knowledge and understanding of the community as a client. And people, place, and function, like I mentioned earlier, are the foundational dimensions of a community, and that needs to be defined as part of the community assessments. So again, we're looking at the community as a whole, and we're learning about the community strengths or even either the community needs as well as the community strengths. And we can do community assessments for a variety of reasons. We can do them to learn about the community, to locate data, to address a community problem. And we can also focus on setting priorities to address health issues in communities. So using the nursing process as a community health nurse, then we can determine the health needs within the community. We can assist in developing and implementing strategies to meet those needs. And then, as part of that, it's necessary to expand the assessment or the nursing process to the community. And assessment of the community is going to begin with defining the community that we're studying. So again, the community can be geographic, it could be demographic, or it could be a common interest, which is a functional community. So when we look at gathering data, measures of health status come in various forms. We can get data from like the US Census Bureau, the CDC. Those are, collected by somebody else. which is known as secondary data. They're obtained through existing reports on the community. So I know, like, I forget how often they do it, but they'll collect data through the census. You get either a phone call or you get something in the mail to fill out the data. The CDC keeps excellent data as well. Primary data is collected through interaction with the community members, which may include community leaders or even interested stakeholders. And there's a variety of ways that we can get some of that primary sources of data. It could be through telephone interviews or going out and meeting people and doing interviews. We can do surveys, town halls, focus groups, or something else called what's called a windshield survey. And we'll talk about what a windshield survey is in just a second. Focus groups, we can do secondary analysis, we can do surveys, like I said. A focus group is like an interview where you're, looking with small groups, you're asking those open-ended questions, right? We know that in nursing, those open-ended questions are going to elicit a little bit more information than, the simple yes or no questions. Focus groups work well when it's not a sensitive topic. They feel a little bit more comfortable when speaking out. So they should be structured to balance a diversity of perspectives. The questions should address the goals for the data. So what are the questions, what's the goal of the data collection that we are collecting? A photo voice is a community assessment in which community members take photos to represent a topic or theme about the community health. When we're working with groups that may be, like have little power, like are more vulnerable populations, like our pediatrics or youth patients or elderly, those living in poverty or those involved in substance abuse. They can communicate their messages about their experience. So imagine, like even some of the things that you see on social media, right? We get a little bit better picture of what's going on from their point of view within the community. So we look at the community as a partner when we are completing our assessment of the community. Again, it's going to focus on that nursing process. So your ADPI, assessment, diagnosis, planning, intervening, as well as evaluation, and know that we can always go back and we can reassess and change that process as we go so that, we ensure that we are able to meet our evaluation goals. All right, so when we're conducting a community assessment, the community assessment, we should plan and visit, interact within the community, and then collect the data about the people, the place, and the function over a period of time so we can get as good a picture of the community as well. We also want to, define what is the community, what are the geographic borders that we are looking at. What is the population within the boundaries? What's the purpose of the assessment? And then we want to identify a data collection plan. And so one of the ways that we will do community assessment is through a windshield survey. Windshield surveys, those are simple observations. It's just a quick overview of the community. It can be used along with photographs and interviews as well, just to get a good overall sense of the community. It's also a descriptive approach. It assesses several community components, and you're really just driving through the community. So when we're doing a windshield survey, what are we looking at? We're looking at the people, who are the people on the street? What's their general appearance like? What are they doing? We're also looking at ethnicity and race. How are the different groups or even subgroups residentially located? Is there any evidence of substance use, violence, disease, mental illness? Are there any animals or pets in the community? We're also looking at the borders, right, or their boundaries. Where is the community located? What are its boundaries? Are there natural boundaries? Are there man-made boundaries? What are the, major health facility? Where are the major health facilities located? What healthcare facilities are necessary for the community, but that are not there or they're lacking? Are there geographic features that can harm the community? Are there plants or animals that can harm or threaten the health of community? What else? What industries are within the communities? Could the environment or the industry pose a threat to the health of the community workers or even the community itself? Is there easy access to healthcare facilities? Are the roads marked well? What type of employment exists? Right? Is it manufacturing? Is it retail, small businesses, military installations? Are there grocery stores where people can buy fresh produce, other than just, frozen foods like small mom and pop stores? Is there garbage disposal or, is there evidence of trash and, abandoned cars or abandoned houses? And then what does the housing look like? Is the housing acceptable quality? How old are the homes? Are they single or multifamily dwellings? Is the housing in good repair or are they in disrepair? Is there vacant housing? Are there social services, clinics, hospitals, dentists, healthcare providers available within the community? Are there enough schools in the community? Are the schools in good repair? Are there parks or areas for recreation? What places of worship are within the community? And what services are provided by local religious groups, schools, community centers, activity, or even recreation centers? Do they have public transportation? Do they have grocery stores within the community? And then do they have public protection? Is there fire, police, emergency medical services, animal control available within the community? Is there, and there's more that is even listed in your book. Like what do you see about politics? Um, what information is provided on signs, other than grocery stores, where do resident shops? What do the parks look like? Are they clean? Are they well kept? Are they overgrown? Is the playground equipment in good repair? Where do they go when they're, do they have somewhere, like they can hang out in those parks? Are there community centers, that kind of thing within the community? And so we're going to take all of this information when we are doing that windshield survey. And then once we've collected our information, we are going then to look to see and identify the problems. So problem priority criteria, things like community awareness of the problem, the motivation of the community to resolve or better manage the problem. What is the nurse's ability to influence problem solution? Is there an availability of expertise in the area to solve the problems? What is, the severity of the outcome if we can't resolve the problems? And then how fast can we reach, can a solution to the problem? So that's what's going to happen. Once we get all the data and we have it all collected, then we are going to identify what is the most important that we can start with and then go from there. And we are going to use our nursing process. So our NANDA diagnosis, right? We identify the problem, its relation to factor stressors or health issues, and then any supporting data that to help us document the system or the problem. And then we will start the planning process. And that's where we analyze and establish the priorities. We, establish our goals and our objectives. We identify interventions and then plan how we will evaluate the effectiveness of the interventions that we are, and putting into place. And then we're going to put those interventions into place and evaluate the success. And it's not just nurses, there are other people that are going to be involved in this process. But it does, nurses are at the center where we can identify and start, the process of identifying the needs of the community and putting those interventions into place. Another big thing that we do need to worry about is personal safety and community practice. And so personal safety should be consideration throughout the process of getting the information that we need. So, you have to have an awareness of the community and common sense. Those are the two best guidelines for judgment. In some cases, calling ahead to clients, letting them know, that you're coming. That helps to prevent the delays. Always letting somebody know where you are. Other things, sources of information about the community will be others that were in the community, whether it's other nurses, social workers, healthcare providers, can give information about a community, those community members, again, interviews, going out and talking with the community that will give you an idea of, what's going on. And then our own observations. Those are things that we gather when we do our surveys or even are collecting data from windshield surveys, from interviews, whatever. Again, just making sure that we're getting as much information about the community as possible so that we can make a proper assessment in order to identify the needs and then put interventions in place to, improve the overall health of those members in that community. All right, and that brings us to chapter 14, which is health education in the community. So nurses are there to provide information to enable our clients to attain optimal health, prevent health problems, identify as well as treat health problems early, minimize disability. That is your primary, your secondary, your tertiary interventions. And so by providing education, we can give that information to our clients so that they can make informed health-related decisions. They can assume personal responsibility for their health and cope effectively. So those are some of the topics that we're going to discuss. We look at Healthy People 2030 examples related to health education, increase the health literacy of the population, increase the proportion of adults offered online access to their medical records, and increase the proportion of work sites that offer employee health promotion. And so when we're looking at designing, implementing, and evaluating health education activities, we do need to learn about the primary health problems in the community, as well as education principles related to learning and technology. So the goal of an education program is to teach what people think they want to learn and in ways that help them or in ways that facilitate their learning. And so we have to have the learners participating and identifying their learning needs. So then the education programs are designed to meet those needs in a variety of different ways. So the typical steps in developing a health education program. First, obviously, we need to identify a population specific learning need for the community health client. So, what's going on when we did that community health assessment? What areas did we identify that the community needs to be educated on? And then we're going to select a learning theory. And then we're going to look at what education principles are more likely to increase learning. We're going to examine the issues. We're going to design and implement the program. And then, of course, we're going to evaluate the effects of the educational program. And so when we look at education, it is an activity designed to help people change their knowledge, their skills, and their attitudes about a specific topic. And so learning occurs when the person receives the knowledge and skills. And this can be difficult for some people. So when we look at designing programs, there's a variety of different things that we need to take into consideration when we are establishing education programs. So when we look at the nature of learning, when we look at the nature of learning, the adults are motivated to learn when they think that they need to know something, that new information is compatible with their prior life experiences, and that they value the person providing the information and believe they can make any necessary changes that are implied by learning the new information. And we have different, domains of learning. We have our cognitive domain, that includes our memory, our recognition, understanding, reasoning, application, problem solving. The components of cognitive domain are knowledge, which requires a recall of learning. Comprehension combines recall with understanding. Application, that's how we take the information in, and then we can use it in a different way. Analysis breaks the communication down into parts to understand the parts and how they relate to one another. Synthesis builds on the first levels by assembling them into a new whole, and then evaluating. Learners judge the value of what that they have learned. Your affective domain, that's the changes in attitudes and the development of values. It involves a change in attitude. So, if a client expresses acceptance of, so let's say we have a client that, has a new diagnosis of diabetes or has had to have a colostomy, right? They accept that they have to have that and they can maintain their self-esteem, and they can continue to grow and learn with that. How does it affect them? The psychomotor domain, that is the performance of a skill. And so, there's some degree of neuromuscular coordination, motor skills. I always do this is see one, do one, teach one, right? When you think about when you're in your nursing labs, right? You learn about how to perform a skill, you perform that skill, and then teach somebody else how to perform that skill. The more you do it, the better that you get out, the better you get with performing the skill. And so depending on how our learners are learning, we need to use all of these domains when we are planning our education activities so that we can include all three types, your cognitive, your affective, as well as your psychomotor domains when we're performing when we're performing the education. Each domain has a specific behavioral component, and each level builds on the previous one. So when you look at Bloom's taxonomy, that's a framework for organizing educational goals and objectives. It's something that we use in education. It helps educators to create effective lessons, design our activities, our assignments, develop our assessments, or even plan or, revise existing education. And there's different levels of Bloom's taxonomy, knowledge, like how do we get you to remember the information, comprehension, explaining the meaning of information. There's application, analysis, as well as evaluation. So those are all things that when we're planning education programs, a lot of times we're using Bloom's taxonomy as a way to establish those. We talked about motivation. So developing effective education programs. First, we need to identify population-specific learning needs. We need to consider the population's concerns, the effect of health needs on the population to determine the priority of the learning need. We want to select aspects of those learning theories to use in our education program. We also want to identify any barriers to learning and different learning styles. So, are they auditory learners? Are they visual learners? Or are they kinesthetic learners? And then we want to design our program. So we're looking to send a clear message to our learners in the most appropriate format. We also want to make sure that we have the best possible learning environment. We want to organize positive and meaningful learning experiences. We want to engage them, and that's where those different understanding the learning styles, the domains of learning, those are all, things to take into consideration. Visual learners, right? They learn through seeing, and methods like note taking or video viewing and presentations. Your auditory learners learn through listening and methods like verbal lectures, discussions, even reading aloud. Whereas your tactile or your kinesthetic learners learn through doing and methods like trial and error, hands-on, that return demonstration. And then some will use a combination of all of those. So the first part of the educational process is to conduct a needs assessment. And that needs assessment will help us to identify what the educational need is. What does the client want to know? And then we're going to collect the data that's, necessary to obtain information about their learning needs, their readiness to learn, any learning barriers. We're going to look at, what we think will increase the client's ability, their motivation to learn, and then we can assist in establishing assist in prioritizing those needs. So we do want to also select the appropriate education material that will help, efficient and successful accomplishment of our goals and our objectives. The method should also be appropriately matched to the strengths and needs of the client as well as the presenter. So we want to choose the simplest, the clearest, the most succinct manner of presentation. We don't want a whole lot of complex things that, they don't need to have. And so when we use that teach mnemonic, T is to tune in. Listen before you start teaching. And that is where we can identify what the client's needs are, because they're going to be the ones that are going to direct the content that we are presenting. then we're going to edit the information. We only want to teach the necessary information first and be very specific about what we are teaching. Then we want to act on each teaching moment. Developing good relationships, teach whenever it is possible. C is for clarify often, make sure your assumptions are correct, and seek feedback. Honor the patient, or H is honor the client as a partner and build on their experiences as well as sharing responsibility with them. Also, when we're looking at selecting appropriate educational methods, we want to consider the age, the gender, the culture, any developmental disabilities or special learning needs, their education level, their prior knowledge of the subject, as well as the size of the group, right? So think of, when we look at, disabilities or special learning needs, do we have patients that are hard of hearing? Are they, blind or have difficulty seeing? What's their native language? So we do need to provide material that is appropriate for everybody that we are going to be teaching with them. And then we are going to provide, anytime we provide education, we should provide it in multiple ways. If you're going to go in and you're going to discuss a subject, make sure that there's pamphlets or handouts that are appropriate to what the education is that you are providing. And then making sure that, it's in their native language, or, it's in, a language a language that is age appropriate or developmentally appropriate, and so that we can make sure that we are giving accurate information that they can understand. And then we're going to implement our education plan, whatever the decision was, what type of education plan that we are going to do. We can do, games, other materials, things that, again, we're going to incorporate all three learning styles so that we can get the best result from the education that we're providing. We look at the skills of the educator. First thing we need to do is gain the attention of the learners. Gaining the attention of the learners usually is, whatever the topic is, how we interact with the learners. We want to tell the learners the objectives of instruction. So what's the purpose for them being here? We want to stimulate recall of prior learning. So we can do that by asking questions, getting an understanding of what they know about the subject already. This way you can also help to clear up any misconceptions that they may have. Present the essential material and then help them to apply it. So say, you're talking to somebody about, checking their glucose levels in a group of diabetics, right? Why is that important? Why do they need to check their glucose levels? How does that affect, the rest of the disease process moving forward? And then encourage learners to demonstrate what they learned. That's why I do the see one, do one, teach one. Have them do a teach back, or have them, teach you or teach another member of the group how to perform that task. It helps to reinforce their ability to perform that task. And then provide feedback, right? You don't want somebody to leave, if they're doing something incorrectly, or you think that there isn't a good understanding of the material, make sure that there's feedback, that, they're doing it correctly, or they're doing it incorrectly, and that gives you opportunity to change that behavior. Other things, we look at, Educational issues, population considerations is a big one. When we look at population considerations, we're looking at, age, culture, ethnicity, pedagogy. Those are learning strategies for those with little knowledge about a health related topic. With pedagogy, the teacher makes decisions about what will be learned and how and when it will be learned. So that type of teaching is usually very teacher directed. Your andragogy, that is more of your learning strategies for adults or older adults and those that have some health related knowledge about a topic. So here in those cases, learners will influence what they need and want to learn. And so when we look to overcome barriers, there's barriers with both the educator as well as the learner. And so when we look at educator related barriers to learning, fear of public speaking. Not everybody likes to get up in front of a group of people and discuss and talk, whether it's, live or even via Zoom. Best thing to do for an educator is to try to be as prepared as possible. Maybe use some icebreakers, being able to recognize the fear of public speaking, practicing in front of a mirror, a video camera with a friend, lack of credibility with respect to a certain topic. Best thing is to increase your confidence by preparing for the talk so that the information is useful. Limited professional experiences related to a health topic. Sharing your experiences, using analogies, illustrations, that help, describe your personal experiences. Inability to deal with difficult learners, basically is to, confront the problem learner directly. Humor, fostering participation of shy people. If the other people are disruptive, ask them to give others a chance. Lack of knowledge about how to gain anticipate or participation. This is where those open-ended questions come into play. You could even call on people, invite participation. Lack of experience in timing a presentation so that it's neither too long nor too short. That's where practice comes into play. You want to make sure that you have enough material to cover the time allotted, but you want to try not to go over the time allotted because that can cause, some uncomfortableness with people if they've only have a limited amount of time to attend. Uncertainty about how to adjust instruction once you're there and you can, talk with the group that you're dealing with, understanding what their needs are, then you can kind of redesign as you go. Being uncomfortable when learners ask questions. Best thing there is to try to anticipate questions, making sure that you paraphrase questions to be sure you correctly understood the question. And then, try to, if you don't know the answer to the question, tell them you don't know the answer to the question, but that you will find out the information for them and get back with them. Sometimes it's hard to use media materials and facilitates, making sure, if you're in an area that you go a little early or you try to go beforehand, make sure that the equipment works, because then you find yourself in a position where you have to change your method of presentation. Sometimes openings and closings are a little bit more difficult. Openings, just jump right in there. Others have, anecdotes or icebreakers that can be used at the beginning, just to try to foster a little bit of sense of community. Notes are great. note cards, visualizer prompts, but sitting in front of a group of people and just reading off of your note cards isn't, usually effective when we're dealing with a group of people. When we look at learner-related barriers, two of the most important barriers are low literacy and lack of motivation to learn. So we often deal with patients that have low literacy levels. They may be embarrassed to admit this, especially to educators or healthcare providers. They may not try to let you know that they don't know, so they may appear a little bit more confident than they really are about the subject. Um, and so we do need to take this into consideration. Um, Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services need to make appropriate health decisions. And so when somebody doesn't know much or does not have health literacy, these are people that may have a limited vocabulary and general knowledge. They may not ask for clarification. They may focus on details and deal in literal or concrete concepts versus abstract concepts. They may select responses on a survey or questionnaire without necessarily understanding what they mean. They may be unable to understand math. So think about, even calculating their own medications, that can be an issue. They also may not be familiar with medical terms or how their bodies work. They are often scared and confused, especially if they've been diagnosed with a serious illness. Um, And so this, when people don't understand their healthcare treatment or follow directions correctly, it can cause significant issues, especially with their healthcare. It can lead to increased numbers of emergency room visits, hospitalizations, healthcare complications. Um, and so why would people, why do some people not have appropriate health literacy? Maybe they have had a lack of educational opportunities. They have learning disabilities, the cognitive, decline that occurs as we get older, as well as, if you don't, use certain information, you lose it. And then some people are just not motivated to learn. Maybe they don't want to learn about what's going on or make the necessary changes in their life. And so, we have to be able to recognize those cues, analyze, and then kind of work on, how do we get them to be a little bit more motivated about what is going on and how they can help themselves. So we look at health promotion. Health promotion helps people to increase control of their health. It does include health education as well as health literacy, and there's a bunch of different models. Your health belief model is an individual level model. It can be used to plan programs. If you think motivation of learners can be a concern. We also, in this health belief model, it contains 6 components. The components are perceived susceptibility. So what will happen to me because of this disease? The perceived severity, if something does happen to me, will it be, a big problem? The perceived benefit, if I do what's suggested, will it really help me? Perceived barriers, assuming I do what is suggested, will there be barriers that will be unpleasant, costly? And then cues to action. What might motivate me to actually do something? And then self-efficacy, can I really do this? So, take that person who was just newly diagnosed with diabetes, the perceived susceptibility. Will something happen to me? What is what can happen as a result of, high glucose levels, right? You look at the risk of diabetic ketoacidosis, the perceived severity. If something does happen at me, will it be a big problem? So what happens when we don't have good control over those glucose levels, right? We look at those micro and macrovascular complications that can occur, right? The neuropathies, the retinopathies, the nephropathies, the benefits. If I do what is, if I do what is suggested, will it really help me? We know that the better control that we have over glucose levels, right, we decrease the risk for end organ damage. So maybe, in these situations, getting a newly diagnosed diabetic, in a support group, or, even meeting other members or other people in the community that have diabetes, so that they can, discuss the other people's disease process, and maybe see, the benefits of really taking care of themselves. And then, perceived barriers, assuming what I do is, assuming I do what's suggested, will there be barriers that will be unpleasant, costly, and so forth? Um, you know, Taking care of yourself generally and trying to maintain good health is generally going to be less costly and less effective, less, hospitalizations than if we're not. It'll be less unpleasant as well. What might motivate me to actually do something? I mean, those are internal factors that need to be addressed. And then, like I said, with the diabetic, maybe getting them in a community group with other diabetics, they may actually help to see, what other people are struggling with and identify ways to avoid that, so that it doesn't happen to them. And then, can they do this? This is that self-efficacy. Do they want to do it? Can they do it? It really needs to be it's intrinsic motivation, to allow them to make the necessary changes in order to keep their health. When we look at technology and health education, there's a variety of things that are out there. We know the internet is probably one of the biggest. The biggest thing with using computer games, videos, internet, CDs, biggest thing that we worry about, especially with the internet, is the information accurate and from a reputable site? You can go on the internet and basically find anything it is that you want to find, whether it's true or not true, whether it's accurate, whether it's inaccurate, helping people to, or guide them to appropriate internet sources is key. That's why, or beginning like your CDCs, your National Institute for Health, your the .edus, the .govs are going to be a little bit more reliable and credible. Does the information that we're looking at, information, is the information biased? Is the information appropriate that they're looking at? When was the last time that the information was updated, like your copyrights? Those are all super important, even, when you're looking up information on, a disease process on the internet, right? If it was published in 1999, has it been updated since then? A lot of changes have been made in, technology and everything. So making sure that, the sources that they're using are up to date. Same thing with CDs. One was the CD published, one was information last updated. And even with equipment, if they have questions about, their glucometer, or they have questions about, I don't know, anything. Sometimes even just reaching out to the manufacturer, they can get up-to-date information, or other resources. A lot of the equipment manufacturers, they do have YouTube videos that are, step by step on how to use the equipment, how to troubleshoot the equipment. So it's really making sure that we are guiding our clients to using the most up-to-date and related information. When we look at, evaluating health and behavioral changes, there's a variety of approaches that we can use. Questionnaires, rating scales, surveys, checklists, skills demonstrations, feedback, direct observation. And so we can do short-term evaluations. Right, that's usually like your see one, do one, teach one, right? You're in a skills lab, you see a presentation on how to do a blood sugar, right? And then you are going to perform a blood pressure check, a blood glucose check, and then you are going to show somebody else how, you're going to teach somebody else how to do a blood pressure or blood sugar check, right? That would be a short-term evaluation. Long-term evaluations a little bit more difficult to do, especially if we're doing community education, but long-term evaluation, we're looking at the effectiveness of that education program for the community after a period of time. And so it's not, it's kind of like just like, if you're developing short and long-term goals for your patients, right? Short term, we have pretty good control over it, but we don't necessarily know what's going on with our patients once they leave the hospital. So those long-term goals sometimes, are more difficult to evaluate. But the effectiveness of your education, with periodic follow-ups will help to improve those long-term goals. We look at health education for community groups. Community groups, they represent the collective interest, needs, values of individuals. They also provide a link between the individual and the larger social system. And so we often provide health education to groups, whether they're formal or informal. Formal groups, those have a pretty defined membership. They have a specific purpose. Whereas your informal groups, those are the ties among members. It may just be, you're at a community function and something happens and you find yourself with a small group of people providing some, guidance and education about a specific issue within the community. Group support often helps people to make needed changes for help. And so that's one of the big things why we have, those support groups that are out there for specific diseases, right? Like your breast cancer, your diabetics, even looking into like Alcoholics Anonymous and Narcotics Anonymous. When people feel like they're part of a group, they get a little bit more motivation to try to make the necessary change within their lives. When we look at choosing groups for health change, health behavior is influenced by the groups to which people belong. So again, it is a sense of support for people within that group. They have somebody, to lean on to, be a support for them. Groups who will support an individual's health change are unavailable to some because of social or emotional isolation. So, think about that. Your HIV, your AIDS populations, your alcoholics, These groups will take you in and almost make you part of their family. So it does provide some really good support. And there's, established groups, like I said, depending on what you need a group for, within the community, there are, there are groups that are available. Some of them may be larger than others. But helping them find those resources within the community is something that we would do as a public health nurse. And that is all I have for chapters 13 and 14. I hope you guys have a great rest of your weekend, and I will see you next week.